Far beyond witches and wizards is the root cause of health problem of many in Africa. Seek professional advice concerning that your health matter.
I see with my clear eye. The eye that I cannot be able to use 2 years ago, I use it now to see everything. And I say, may God who make this man have this mind, and all those doctors will be here. God will bless them and give them more life.
Join Dr. Save a Life Foundation.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Hello, nice to have you again in this wonderful edition of You and Your Health. Today is gonna be a big bomb. You know why? It's gonna be very expository, and as a matter of fact, what your academic privileges may have denied you, you have the opportunity of getting it right here. And most importantly, not just for yourself, you're gonna save the life of millions of people, children, and also our dear mothers, our women. We just have to together, by reason of the knowledge of today, be able to fight this cause together to save the life of our people. We have a very deplorable statistics when it has to do with the infant or neonatal mortality and maternal mortality. It's so horrible. Abroad, most children don't die during delivery anymore. The mothers don't die again. How come our own is completely the opposite? And we were able to have a very, very disturbing story last time, which we shared here, and try also to demystify, as a matter of fact, a misconception when it has to do with the delivery and the so-called Hebrew women delivery. You can remember that. For some of you that didn't actually participate in our last episode with respect to Hebrew women delivery, I want you to visit our YouTube channel and be able to have access to it. And when we are here to declare very vividly, there is nothing in the Bible called Hebrew woman delivery. It was an acquired grammatical aberration that the women that were delivering the babies, because of fear of God, hiding from Pharaoh, when confronted, they said, no, we never did that. Only that the women were smarter, and they were very smart that they delivered before we came in order to defend themselves before Pharaoh. And we acquired that, unfortunately, from our forefathers, and stating that you have to deliver like a Hebrew woman. You have the opportunity to read about it. It's right there in the book of Exodus 1, verse 15 to 19. Read it again before you begin to make unfounded argument on that. All right. But having been able to establish that, many people say, wow, it's wonderful. But one of the messages I want us to look at happen to be on the aspect of perhaps the wickedness of the doctors in making the choice for cesarean section. And I want us to look at this very message together. This message came from a mother. She actually said, I had my second cesarean section after the doctor convinced my husband that I should go for it. My first baby was 4.2 kg for the reason for the first cesarean section, but the second one was 3.1. I'm not happy because doctors want to make money by doing CS by any means. Quite interesting thing, of course, and something very much of a big concern. Of course, so many doctors, they want to do cesarean section because they want to make money. Could that be true? I'm not here to defend her, but I'm here also to let you know it is wickedness of the wicked for a doctor to see his own patient or her own patient and want to subject that very patient to cesarean section because the person would have otherwise delivered by normal vaginal delivery. I want you to pick your phone. I will reveal some things that will not just amaze you but equip you not to be a victim to any form of manipulation of any kind, even information flying. Because this why I have to come up with this is to be able to let us reason together. You know, God usually say, come, let us reason together. Bring forth your strong reason why which you should be justified. This is a strong reason that why cesarean section or why doctor prescribes cesarean section is because it is something that maybe the doctor want to make money. Okay? Call your friends, your loved ones, ask them please, tune into this station now. Did you know what? We all have sisters, we have children, we have grandchildren, we all have someone somewhere right now that you should be tomorrow a Messiah as it were to, by reason of the knowledge you will get now. Do it. I will be right back to show you why this story may be true, may not be true, and if it is not true, how true or how not true is that. I want you to stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. You're still on You and Your Health. I remain your friend, Dr. Richard Okoye. And we got a very, very concerned message. One of the fans of this program sent a text, and I hope you should be here also to hear the answer to that. Because he said that she had her first baby, and the first baby was 4.2 kg. For that reason, perhaps she went for cesarean section. And the second one, she wanted maybe otherwise not to deliver by cesarean section, but he said the doctor convinced the husband. And the husband made a choice that the second cesarean section was done, and she wasn't happy about that. Perhaps that doctor decided to do that because she needed money. Now let me tell you why a doctor could be in position to make a decision and ask you, madam, you have to be in position to go for cesarean section. I will tell you something today. I want you to keep, if possible, begin and go and get a note and start writing. There are things that can make a doctor to have an informed opinion to ask you or advise you, even though he says that you should be able to deliver. He may not have the full conviction to allow you to do so. That someone has the first cesarean section never imply that there's no opportunity for the person to deliver vaginally. No. Because what may cause the first one, and she rightly said that the baby was 4.2 in her first pregnancy. So she may have a problem with the skull last time that is called cephalopelvic disproportion. What does that mean? That the birth canal in conjunction or in relationship with the head or the size of the baby, they are not compatible. What does that mean? That maybe the head now is big and the canal is narrow. So if you allow that baby out, the baby may die, the mother may rupture her womb, and some other things we will consider here. All right? So that may be the reason for the first. Now, coming again, the second one, she wanted to deliver vaginally, and the doctor now advised that she has to deliver by cesarean section. Let me put this in here. In as much as a woman has an opportunity to deliver vaginally the second time, it is the duty of the doctor that is protecting this woman professionally to look at other obstetric factors. What are these other obstetric factors? This woman under normal circumstances would have been allowed to push. All right? But the doctor may look at what we are not told in this very text message. If the gap between the time she delivered the first one and the second one was so short, because it's advised at least if you do cesarean section, wait for 1 year. But in a situation where this person got pregnant soon after the cesarean section, the doctor may be a little bit skeptical. And I said, because of this short time, you may not be in position to deliver them. I advise you to go for CS. All right. Secondly, in a situation where that same woman, despite the size of the baby being big or small, but may have a contracted pelvis. In our last program, I was able to show us this, that this is what is called gynecoid pelvis, and also you could have this type of android pelvis, and the other ones are for academic purpose, that a woman with this type of pelvis, which is present in 20% of the women, whether this person has small baby or whether he has very large baby, he will not be able to pass the canal. So the doctor may become to say that not just because of the size of the baby, that this woman birth canal may still be able to impose a problem. You get that? In a situation where in that very years, there was a complication or wound infection. If there's a wound infection, there is a tendency that very wound that is healed may not be as strong as it ought to be. And on the fear of that, the doctor may give a professional advice and say, madam, in as much as you have a chance, but because of the event of that particular wound healing may be more fibrotic, that if much pressure comes on it, it may tear from that. And wound rupture is not just deadly to the baby, it's also deadly to the life of the woman. You get that? Now we go further. Also dependent on the prevailing circumstances during cesarean section. That's why it is good, no matter where you go, if you have done 4 cesarean section, always tell your history to the second doctor. Wherever, tell your history. That's why if you see most hospitals, you will see some bad obstetric history written or read. That this woman has suffered this or this or this. It gives the doctor a broad insight, opportunity the woman has. Okay? So on that particular occasion, if the surgery, which was supposed to be done this way, but on a prevailing circumstance, maybe fibroid or something being there, and it goes more classical, more longitudinal, tendency means that wound will take a longer time to heal, and anything to be used on a shorter time, the tendency of that wound will rupture. That's why your doctor is there for you. Be that as it may, I'm not here to defend whether doctors are good or whether some doctors or whether some hospitals are doing that or not. The question is simple. Before we start getting confused and trying to have a generalized opinion, going to hospital is a choice. Making a choice of a doctor is also a choice. If you go to a church, you don't like the pastor, you don't have to be there causing confusion. You have other places you will go. So I feel that doctor-patient relationship is a mutual thing. It's something that is mutual. If you are not satisfied, you don't need to be in position to generalize. Oh, this is the way they are. You can make another choice. As a matter of fact, the joy of the patient is the joy of the doctor. The patient testimony is also the doctor's testimony. So let us not be in position to generalize it, because if I'm not satisfied with your services, I can decide to make an alternative where I have that trust. So the issue is that trust is something that is optional. Trust is something that is individual capacity to do. So don't generalize that the doctors are making money because they want to do cesarean section. Now, having said that, I want us to go further. Hear me. I want us to go further. For you to see that before someone tells you, you will deliver like a Hebrew woman, you will ask this very question I want to ask. You know, so many people have come to the altar and say, praise the Lord. Doctor said that I should not deliver, that I will go for cesarean section. I reject it. I said I will deliver like a Hebrew woman, and I delivered. I will tell you that very testimony may be premature, because most of those babies delivered under that circumstance, the outcome, you will not like it. I will expose some things that will help you. Affliction shall not rise the second time, but it's expected that you know why the first one happened, so as to prevent recurrence. Stay tuned. When I come back, I will tell you major reasons why cesarean section is for the safety of our babies, and the safety of our mothers. Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. You are still on You and Your Health. Today is a very critical day. Even if you call somebody now to hook in, I'm telling you, you can save lives. This is a campaign we are carrying out in line with our project 2025. That Nigerian life expectancy will move from 55 to 70 years. And this time around, I want us to ask this very question. Why do people have to go for cesarean section? Now I tell you, if you go into labor, I want you to understand what's about to happen now. And also use this opportunity to call upon our traditional birth attendants. You have maternity, listen and listen go. You are a nurse, you want to deliver you are a midwife, whatever you are. Can you just let me hear? This is a cause of operation, save a life. It's a mission to save life. Now, labor is expected to last under normal circumstances for 20 hours. That anything beyond 20 hours is described as prolonged labor. Okay, some school of thought takes 18 to 24, but within an average of 20 hours, it's expected that a woman should deliver. But something may happen that this woman will not be able to deliver, and I want you to listen go. As pointed out, we have two major players when it has to do with normal delivery of a baby. Number one is the birth canal of the mom, and also the head or whatever portion that is actually coming out. And on that God, I showed you something here. This is the birth canal. The baby's head goes into here. Alright? And then you see now, this is the head of the baby engaging here. Of course, you can see comfortably that this birth canal can comfortably allow this very baby to come out. So it is expected that by reason of this engagement, all right, that this particular baby should be able to come out, because the birth canal was able to accommodate it. All right, that is what is called engagement. Having noted this relationship, that the head is able to pass through, that is engaging that birth canal. But in a situation where this very head of the body is big, not able to pass, or the woman's pelvis contracted, as you say in some cases of android pelvis, what will happen? It will come to a point that that woman will stay in labor. Somebody say push, you see contraction, the woman will be shouting, but no progress. And I want to encourage, for those of traditional birth attendants, the nurses, the midwives, wherever you are, I want to appreciate you for your helping our women. You have a maternity, you are helping our women. Thank you for that. But I want you to listen well. You can do much more. There's no issue of trying to show, no, I deliver 4.2 kg, I deliver 10 kg. Fantastic, that baby come out. But the future of that very baby, you can't guarantee. On that I call, in a situation where you are delivering and the labor is progressing, yet baby is not engaging, you should watch out. You look at it, you look at the cervix. The cervix has already dilated for you, or partially dilated, but now looking in the matters, looking as if it's getting swollen. You should know that something is happening, and the head of the baby is still very high. Something is out. Sometimes you may have caput, where the flesh of the baby may even be projecting out as if it's trapped. At that point in time, something should tell you that the labor of this woman of 9 months is about to diminish. That this woman in your hand can tear her womb and she can die. At that very point, you look at the vagina is dry and very hot, and you see the vulva very edematous. Please, don't do Superman or Superwoman. Take that very woman to the hospital to be sectioned as quickly as possible, because that will lead to obstructed labor, the death of the baby, and possible death of the woman, as we discussed in our last meeting. We can't continue to have this kind of a thing because nobody talks about it. We cannot continue. But the knowledge today should be able to help each and every one of us. Now, I should tell you something more. Apart from the issue that has to do with the pelvic canal or talking about the size of the baby, there are other things that could be able to say, hey, doctor, help out at this point. And what are those things? You know, number one is that there's what is called placenta. Placenta is what happens in the third stage of labor, whereby it is that placenta that gives the blood to the baby and also takes some things out. But you know what? I want to show you something here. Watch this very closely. A normal placenta should be in position to be located at this very fundal area of the uterus. You see the baby here, this is the end point where the baby will come out, the cervix, and the placenta is usually almost behind in most cases, all right? But in a situation where a doctor has been able to look at this, and maybe through ultrasound, and it's revealed that this very placenta is now being located about the axis where this very baby will stay. This is what is called placenta previa. Listen to me. If this bag of blood is covering where the baby will come out, it is at that point they say that it is contraindicated. What do you mean contraindication? Is that you should never do this. To be in position, even a doctor, to do a pelvic examination on a woman with this. Because if you put your finger here, it may burst this bag of blood and you will see torrential hemorrhage that can kill that woman. And that's why, for you as a traditional birth attendant, for you owner of a maternity, well done. But always over the mid-cycle towards the time of the delivery, at least do one pelvic scan with emphasis on the location of the placenta. If the placenta is located this way, sometimes, honestly, it can move before the delivery. But some, if they persist this way, dare not ask this woman to push. You will kill this woman because the placenta and the cord is horrible towards this side. There's nothing that can be done about it. That baby will die. That woman will bleed. And it will bleed in a way that you can't control it. At that point, what is recommended to save this woman and her baby is that this woman should go for cesarean section. Take the baby out and nicely pull out the placenta. In the next one, the placenta may not be there. In the next pregnancy, the placenta may not be there. So that's why this is not an absolute indication for cesarean section in subsequent one, because he may be here this time and next time he may be in the right position. So why should the doctor take that decision for his selfish interest or something that you trusted him to make a better professional opinion or professional choice for you? It's not that they are looking for money. To be in position because their joy is the joy of your doctor. Your testimony is your own doctor's testimony.
You and your health with Dr. Richard Okoye.
I cannot believe it that this is the same me that came here with not having the hope of being on my feet again, that I can walk again like a normal human being. I want to thank Dr. Save a Life Foundation for this wonderful work. To God and to God only be the glory.
You and your health with Dr. Richard Okoye.
Welcome back. I do hope this program has been a blessing to you. I want you just to partner with Dr. Save a Life Foundation. Think about your constituency. Think about your people. Think about your company. We could be in position together, run both ECG, train people how to respond to emergencies, prevent some of these prostate cancer, cervical cancer. You can be in position together, sponsor this thing to help your people. We are very much available. You can call any of this number to reach us. Most importantly, this program coming your way, I know it's a blessing to you. Why not be in position to look at this account number and support it? As I appreciate what you people are doing, Support it with whatever you have. If you can continue this effort, think what posterity will talk about us. It is amazing, and I believe that together we can build a healthy society. Now, you could also be in position to talk about maternal safety. What is maternal safety? A woman may have a baby, but the life of the woman is also important. And how is it important? This particular woman may have what is called pregnancy-induced hypertension, otherwise called preeclampsia. Sometimes the woman, if you left, it can fit. You see, the BP will be going, that woman can die. Doctors will make effort to see the BP can be controlled, and it's not being controlled. Safety means safety for the mother. That baby can be delivered as quickly as possible. And that's what brought about the sometimes, you see, premature delivery of a baby, because the safety of the mother is also important. Let's look at a woman who labored for 9 months, but because she has diabetes, it could be pregnancy-induced gestational diabetes, it could also be somebody who is already diabetic. And in that particular case, diabetes usually associated with a big baby. And towards the ending of pregnancy, sometimes they may have a stillbirth of unknown explanation. Okay? So for that reason, the doctor will say, Madam, I will not allow you to go towards the ending of the pregnancy. Why? At that point, this very placenta, there could be what is called placenta insufficiency. They may not be able to be bringing enough food to satisfy the need of that big baby, following the high insulin level available to them. And what will happen? That particular baby can suddenly demise. And that's what at 8 weeks, doctor will say, once you reach up to time of fetal maturity, let's deliver this baby. And most times when they deliver the baby, if it is pregnancy-induced hypertension or pregnancy-induced diabetes, most times the BP and the sugar also go down. The baby is there for the mom, and everybody is happy. But somebody will say, no, I won't take it. It's not my portion. Ignorance is the mother of personal destruction, a voluntary misfortune. And it is worse when you are ignorant of your ignorance. God bless you. I'll see you again.